All right, how do we actually treat cosmetic spider veins? Well, you have two options. You can use sclerotherapy with my preferred medication, Sclera, or you can use laser guns. Both are incredibly fun. Let's talk about them. So what is Sclera? Sclera is polidocanol. So polidocanol is the generic name of an FDA-approved injectable detergent solution, which can be used for the treatment of cosmetic spider veins and reticular veins. Now we're talking 3 millimeters or less in the lower extremities. This medication works by damaging the endothelial lining of the vein. This triggers vessel collapse, thrombosis, and resorption of the vein. Your body actually gets rid of the vein completely. It was FDA approved in 2010 specifically for cosmetic sclerotherapy, and so you don't have to worry about using anything off label. In my humble opinion, after doing thousands and thousands of cosmetic vein procedures, polidocanol and Sclera specifically is the very best medication on the market for cosmetic sclerotherapy. Here are some before and after pictures of Sclera patients. You can see, this takes several weeks, even a couple of months to clear. You can see a little ghost of vessels here in some of these, but you can see excellent clearance. And this comes honestly with the best side effect profile and the most comfort and tolerance for patients. So the mechanism of action of polidocanol, it is a non-ionic surfactant or a detergent sclerosant. When it's injected into a vein, within seconds, it disrupts the endothelial cell membranes, which controls, it causes controlled endothelial damage. This leads to thrombosis, localized thrombosis, and platelet aggregation. The vein collapses, and eventually the body will remodel it completely. It'll have fibrosis down the length of the vein and then gradual resorption. You get beautiful results. This process eliminates a vein from circulation, which is not properly functioning. This is a broken vein. We eliminate it from circulation, and that causes visible spider veins to fade over several weeks to several months. Now, you might have used other forms of sclerotherapy. You might have experience using hypertonic saline or glycerin or STS. And you might ask, why is Sclera better? Because Sclera is a bit more expensive, but I am telling you, it is worth it. It has better patient comfort. It has higher patient satisfaction. It has much lower inflammatory reaction, lower risk of skin complications overall, specifically hyperpigmentation, skin necrosis, and ulceration. And I will tell you, as someone who worked all the way through COVID, when I had problems with my supply chain getting Sclera and polidocanol, I had to use STS. That was partially due to supply chain issues and partially due to where I was working at the time. And I had a lot more incidents of all of these things. Now, is hyperpigmentation and ulceration the end of the world? No, these are all things that will eventually go away, but they are distressing to patients. And this drug is so much better in so many ways. So overall, you get similar and or better clinical efficiency, and true studies will show this in cosmetic outcomes, and especially when compared with STS, and definitely fewer complications. I noticed that firsthand. What are the takeaways for aesthetics clinics? So this Sclera is an FDA-approved cosmetic indication. It has predictable dosing and concentrations of 0.5 and 1%. It has a proven mechanism of action with a high safety profile. There are many patients needing this treatment and not very many aesthetics clinics that offer it, which puts you in a great place. I explained earlier, this is an insurance black hole. Insurance really doesn't cover it, and so there are a lot of patients looking for this treatment. There's minimal downtime, and it is ideal for high-demand cosmetic vein treatments. Polidocanol and Sclera, they give excellent cosmetic outcomes and high patient satisfaction. I promise you, amazing return on investment. And finally, it is incredibly fun. Of all the things I do in my office, it is the most fun. So I'm going to leave you with this. I've been treating thousands of patients for over a decade for cosmetic spider veins. I use both sclerotherapy and laser treatments. And we, at my office, we conduct online, webinar, and in-person training available for both sclerotherapy and laser. Whatever your needs might be as an office, as a single person, as an entire office staff, we train on the science, practical techniques, and the business acumen of bringing sclerotherapy into your office. You can use the discount code Sclera at my website for $100 off your choice of whichever course you'd like to take. I would love to answer your questions, and I would love to see you in the office. Happy injecting.